Hello everyone, today we will be discussing classification of fractures. So first, why we need to classify fractures? We need to classify fracture for communication among health workers, to formulate the plan of treatment, for the prognosis of fracture, and to decide the outcome of treatment. Now, what are the bases on which we can classify fractures? So, the first basis is the pattern of fracture. Second basis is the displacement of fracture. Third is relation of fracture to external environment. And fourth is on the basis of etiology of fracture. So, we will be discussing each basis in detail. Now, the first basis is the fracture classification on the basis of displacement. On the basis of displacement, fracture can be undisplaced or displaced. In the first picture, we can see there is the fracture, but the fragments are not displaced. Fracture are anatomically aligned with each other. But in the second picture, we can see there is the fracture, but the two fragments are not anatomically aligned with each other. So, the fracture here is displaced. On the basis of displacement, the displacement could be translation or shift, it could be angulation or tilt, it could be a rotation, or it could be a change in length, that is shortening or distraction. So, translational displacement, it is a sideways displacement of fracture, and sideways displacement can occur in the two planes, in the coronal plane or in the sagittal plane. When displacement occurs in the coronal plane, it could be a medial displacement or lateral displacement, and if it occurs in the sagittal plane, displacement can be anterior displacement or posterior displacement. So, this is the sideways displacement, which is known as the translational displacement. Now, second is the change in displacement, change in the length. So, it could be a shortening. So, shortening is the when the two fragments overlap with each other, or it could be a distraction of fracture fragment when the two fragment goes far apart from each other. So, that is the distraction of fracture. So, change in the length could be a shortening or it could be a distraction at the fracture site. Now, third displacement could be the angulation of the fracture. So, when the two fragments angulate or tilt in relation to each other, then we say that displacement is angulation. Now, fourth is displacement could be the rotation. So, here the one fragment twist around the longitudinal axis of the bone. So, how we appreciate the rotation of the fracture fragment? So, if you see the width, if it is not rotated, the width of the two fragment is equal, but when it rotates, the width of the one fragment decreases. By this, seeing the width of the fracture fragments, we can say whether the fragment is rotated or not. Now, another basis on which we can classify the fracture is the basis on the etiology. So, on the basis of etiology, the fracture can be traumatic fracture, it could be a pathological fracture or stress fracture. Among these, the most common is the traumatic fracture, which occurs due to the trauma. Now, stress fracture. So, fracture occurring in the normal bone of healthy patient due to the small repetitive stress, but not due to any specific traumatic incident. So, in this picture, we can appreciate the subtle fractures which is in the stage of healing. So, there is the periosteal reaction. So, stress fracture occurs in the normal bone without any trauma, but due to the repetitive stresses. Now the another etiology of the fracture is the pathological fracture. So whenever the fracture occurs in a bone already weakened by the disease process, then we call it a pathological fracture. Now in this picture we can see the different bone which has been weakened by the different disease process, and there is the fracture. So all these are the pathological fracture because the fracture is occurring in the already weakened bone by the different disease process. So disease process can be a tumor, it could be an infection, it could be other metabolic disease. So in the first picture we can see the bone, there is the fracture and bone is weakened by the tumor chondrosarcoma. In the second picture there is also a fracture, and the fracture is occurring in the weakened bone due to the infection. In the third picture, this is the picture of the Paget disease and there is the fracture, so it is also a pathological fracture. In the fourth and fifth there is the metastasis and there is a vertebral fracture, and there is also another fracture due to the metastasis, and the sixth picture is the fracture due to the myelomatosis. So whenever the fracture occurs in the already diseased bone, so we call it a pathological fracture. So another basis is another basis of the classification of fracture is on the basis of pattern of fracture. So it could be a transverse fracture, oblique fracture, spiral fracture, comminuted fracture, or a segmental fracture. So how does the fracture looks? What is the morphology of fracture? On that basis we classify. So transverse fracture, you can see in the picture, the transverse fracture is perpendicular to the long axis of bone. In the oblique fracture, there is the fracture line which makes an angle with the longitudinal axis of the bone. And spiral fracture is the fracture which starts at the one point of the bone in the one plane, and it traverses proximally or distally, and then the fracture exit at the other side and in the other plane. So it's like a fracture occurring at the one plane at one side and exiting in the another plane and another side. So that is known as the spiral fracture. And fourth is the comminuted fracture. So previously in the previous slide we saw that whenever there is the fracture, we have at least two fragments of the bone, the proximal fragment and distal fragment, and the distal fragment. But whenever there is more than two fragments after the fracture, then we call it a comminuted fracture. So in this picture you can see there are so many fracture fragments. And another is the segmental fracture. So segmental fracture has also got the more than two fragment, and we have one, this is the proximal fragment, this is the distal fragment, and in the middle we have the middle fragment. So by definition it has also got the more than two fragments. So what is the difference between the comminuted fracture and segmental fracture? So in the segmental fracture, middle fragment has the whole circumference of the bone, but in the comminuted fracture you can see there are different small fragment which does not have the whole circumference of the bone. So that is the difference between the comminuted fracture and the segmental fracture. So thank you.